Hello, everybody. This is the Psychology of Human Sexuality, and today we're going to be talking about the anatomy and physiology of males. And so, as always, I recommend that you pull out your PowerPoint and take a look at it while you are watching this video. So you might need two devices. And the first thing that we'll talk about is the purposes for male sex organs. It's very similar to female sex organ purposes, but with one addition. So reproduction, waste elimination, which is the different one, bringing pleasure to oneself or to others. So one thing to note is that humans are very much alone, with the exception of one or two other animals in the world, who has primarily recreational sexual activity. About 90% of all sexual activity that humans engage in has nothing to do with procreation. One thing that we want to talk about right off the bat is whether or not circumcision is a form of genital mutilation. We talked about female genital mutilation, and so you should know that there are lots of folks who do not want to be circumcised. They would prefer to be the way they were when they were born. And they say, for example, that as an infant you have no choice in the matter. It's really up to your parents. And in fact, much of circumcision is the result of religious beliefs. It isn't medically necessary. There are a couple of advantages under certain circumstances, but it is not necessary. And only about 30% of the world, males, are circumcised. Okay? So this is interesting, yes? If you look at a map of the United States, you'll see that roughly from east to west, there is a reduction in the percentage of people who are circumcised, males obviously. And so if you look at the Ohio Valley and the Upper Plains states and the parts of the South to the east, southeast, upwards of 85% are circumcised, but on the West Coast, you're looking at 10, 11, 12%. Big difference, yeah? All right. Worldwide, we know that African nations are more likely to be, far more likely to be circumcised than parts of Asia, and South America and Central America. Okay. So, are there any medical benefits? Well, it's not a medical necessity, but there could be some benefits. So, if you remove the foreskin, then you will have a automatic sort of a slight reduction in penile cancers and a slightly improved, slightly lower susceptibility of urinary tract infections and sexually transmitted infections, including HIV. But, you can correct most of that by just staying clean and washed, yes? There are medical risks, of course, aside from the fact that you're not making the decision to be circumcised as an infant. The medical risks are on the negative side as well, and they could include surgical complications, hemorrhaging, infection, and so on. There's also certainly pain during circumcision. It doesn't last long. In addition, we don't really know whether circumcision affects sexual functioning because it's difficult to research. You'd have to have adults that were already sexual before and after some circumcision that they had. So you'd have to get a before and after, and that population's pretty low. So they even have on the West Coast protests and marches against circumcision. They make some claims that are not true, including that circumcision cuts 75 or more percent of nerves and so on, but no, that's not true. Now, is there emotional or psychological harm, deliberate harm? Well, Freud thought so. Freud thought everything was traumatic, that we repressed much of those sorts of things. But there's no solid evidence that suggests that there are any lasting effects. Now, here's something interesting. Some people want to restore their prepus, which is the foreskin, and they go to great lengths to do that, pardon the pun. They actually can attach one or more devices that pull the skin just below the coronal ridge of the penis downward, either with a spring-loaded device or a weight system or something of that nature. Okay, so and it requires a very long time, a year or more, to restore skin in that way. So you'll want to look at the diagram that is on slide 11. And on this diagram, we show you all of the parts of the penis. The root of the penis, which is what enters into the body at that point. The thing you will immediately notice is that the two parallel tubes in the penis, the ones that fill with blood, are named the same as the cavities that are named in the clitoris. In fact, it's the same structures. We call those the corpus cavernosa. One is a corpus cavernosum, and they extend into the body of the male, just like the female clitoris into the body of the female. And they are called the same things. The crura is both of them, and crus is one of them. We also want to talk about the Corpus Spongiosum, which is a name because it's a spongy material that encompasses the urethra as it exits the body. It's on the lower portion underneath the penis, and hence the small ridge that you would see under the penis. And it cushions it, and that extends all the way out to the glands of the penis, to the exit into the world outside the body, which is called the meatus. Okay? All right. So let's talk about what the penis is. Penis is Latin for tail. It comes from that word anyway. And it is the organ through which urine and also semen passes. The shaft, again, contains parallel columns of erectile tissue called corpus cavernosa. I'm repeating this on purpose. And they become engorged with blood. There's a central vein in those corpus cavernosa. And then this corpus spongiosum, not to be confused, contains the urethra. And then at the exit where the meatus is, it actually forms the glands of the penis. And that's the part of the penis beyond the ridge of the penis. Okay? So the underside of the penis, below the coronal ridge, is a triangular portion of tissue, and that is called the frenulum, and that is a very, very sensitive area of the penis. It's where the foreskin attaches into and up against the coronal ridge. Okay, so we call the head of the penis the glans penis. Sometimes people just say the glans. And the corona is the rim at the base of the glans. And the frenulum, one last time, is on the underside of the penis, and it's the triangularly shaped skin. And the foreskin, again, is the sleeve-like covering. It goes over the end of the glands. When males have an erection, that erection often causes the glands of the penis to extend beyond the foreskin. And of course, the foreskin can always be manually retracted or slid down. Okay? All right. So, a few interesting points about penises. Size is not strongly linked to body size or weight, muscular structure, sexual orientation. None of those things. There is no relationship between penis size and the ability to have sexual intercourse, and for the overwhelming majority of males to satisfy a partner. Now, there is something called micropenis, which is a consequence of a genetic disorder, and that penis may be only about an inch long or less, and fairly narrow in width. That may be an exception to that statement about size. Okay, so the actual shape of the penis is a boomerang because it extends into the body and the crura go down. They curve and go down. The average U.S. flaccid penis size is about 3 to 4 inches, and the average U.S. erect size is about 6 inches, 5 to 7, somewhere in there. Now, when a penis is erect and it happens to bump into a thigh or I suppose a wall, if you were running in the house with an erection, I don't even know what I'm saying, but anyway, maybe I'm talking about a fraternity. I don't know, but that didn't even sound right. But anyway, if you bend the penis, okay, here's the penis. If you bend it, then this side is going to go far out and stress the corpus cavernosum on that side, and it can actually tear it. Okay, it's a rupture, and then that begins to fill the area between the rupture and the skin of the penis with blood, and that can get very large, and it has to be attended to in an emergency room very quickly. And what they do is they take the skin sleeve out down the shaft, suture the corpus cavernosum, and then reattach the skin at the top. Okay, so if you talk to emergency room physicians, you would find out that virtually all of them have done that multiple times, and they have told me that generally speaking, it's a Friday or Saturday night that happens. Yeah. Okay, let's talk about the scrotum. The scrotum is the pouch of skin that holds the testes, and the testes are where testosterone is produced. It is also where the initial stage of sperm formation is accomplished, and the scrotum is an amazing thing because it is contained within it the testes, which are wrapped in a musculature that's coiled so that it can regulate the temperature of the testes and hence the production of sperm by raising or lowering the scrotum based on the temperature of the outside world. So if it's extremely warm, then that muscle uncoils and the testes descend. And if it is very cold, it tightens the coil and the testes go up towards the body to keep them warm. The scrotum is divided in half by what's called a septum. It's a line, and so it is also fairly pigmented relative to surrounding tissue like thighs and so on, and it is usually sparsely covered by hair. So again, with its testes, they're about the size and shape of large olives. 1.5 inches long and about 1 inch in diameter, and the size and weight decrease as men age or have other medical issues, or even smokers have increased size reduction of their testes. So the left testis usually is one that hangs lower than the right, and the testes on each side are suspended by what's called the spermatic cord. Okay? Sperm are produced initially in what are called the seminiferous tubules, and those are in the testes. And then the sperm are moved into what's called the epididymis. And the epididymis is the structure that looks, if you look at the front of a testis, it looks like it's C-shaped. It's over the top, but if you look behind, you see that it's wrapped around on the opposite side, behind it. So the epididymis is where the final maturation of the sperm occur, and where the sperm are readied for ejaculation, should an ejaculation occur. If there's no ejaculation, then those sperm are reabsorbed. But because sperm are constantly being reproduced in huge numbers, that's never an issue. Okay? So that epididymis contains the sperm that are eventually mature, and then during sexual arousal and contractions that occur with the beginning of ejaculation, the sperm is squeezed into the vas deferens, also known as the ductus deferens. That is a long muscular tube running from the epididymis all the way up into the pelvic cavity to just behind the bladder, and then it merges with the urethra. Okay, so the vas deferens, the ductus deferens, joins the ejaculatory duct within the prostate gland. Now, once that semen, which is not yet fully composed, there's more materials that go into semen, it is now in the urethra, okay? And when it's in the urethra, due to sexual excitation and ejaculation, which is beginning, the bladder is closed off. So once there's an erection, basically, there's the sphincter at the opening to the bladder, and it's closed. That prevents the semen from going up into the bladder. Now, as you might imagine, there are some conditions and medications under which that doesn't happen, and the sphincter remains open, and the ejaculate can go up into the bladder, and then upon the next urination, it would be urinated out. Okay, so the first bit of material that's added to the sperm and the little bit of fluid that the sperm is being carried in up the ductus deferens is seminal vesicle fluid. The seminal vesicles are like little sacs. They like almost look like bubbles, as pouches almost, really, near the base of the bladder, and they produce a sugar-rich fluid. And in fact, the material is fructose, or fruit sugar, basically, and that gives the sperm added energy. The sperm picks that up in the mitochondria of the midpiece of the sperm to allow it to continue on its way to the egg, should there be one, and so that's pretty cool. That gives it enough energy to get there. The fluid of the seminal vesicles and the prostate contain the majority of the fluid in volume that you have in ejaculation. Now, the next fluid that would be added would be within the prostate. The prostate is below the bladder, and it's walnut-sized. In fact, it kind of looks like a little bit like a walnut. And it's located just below the urinary bladder in front of the rectum. This is the organ that can be palpated with a finger inserted into the anus of a male, which is what doctors do periodically as men age, to judge the size of the prostate, to make sure it's not too enlarged, to evaluate whether there may be reason to look further if they feel bumps or odd places that might signal that there is cancer, and so on. But the prostate contributes quite a bit of fluid, and it is fluid that not only nourishes the sperm, but also increases the increases the pH to offset the acidity of the vagina. Okay? So because the urethra goes right through the prostate, what you can imagine is that if the prostate is enlarged, it makes it difficult to fully void the fluid in the bladder. And that's what happens with older men who have an enlarged prostate, which is a very common situation. And when that happens, males will awaken during the night and feel a bladder that's filling, and they need to urinate, and what happens is they can't really void the whole bladder. So they go back to sleep, they feel a little bit better, but then they wake up again. So this creates a lot of fatigue in males that have to do that. And there are some medications and even some natural things that may reduce the size of the prostate. Usually prostate enlargement is a benign condition called prostatic benign hyperplasia, BPH, but sometimes it's the result of cancers. So now, the last bit of fluid that's added is really added to the urethra before the semen gets there. And it's added by what's called the Bulbourethral Glands, also known as the Corpus gland. It's a pea-sized gland, really, and it's located on the sides of the urethra just below the prostate gland. Okay? And it creates and puts into the prostate through a little valve a very clear, slippery fluid, and that serves to lubricate the urethra and possibly also to neutralize some acidity that may be there because of some urine that may be left over from a urination. And so it's trying to help the sperm get to where it needs to go and protect it a little bit. Okay? So this is the clear, small amount of material that's at the meatus of the urethra at the end of the penis during sexual excitation. And as men get older, there may be not much that is secreted by the bulbourethral glands. There may be none that you see at the end of the penis. Okay, so let's talk about male gametes. In other words, sperm. Female gametes are eggs. So sperm swim using a flagellum. It's a very primitive, common way for motility to occur in single cells. You may have seen in 9th or 10th grade biology that euglenas, that are single-cell pond-dwelling organisms, have a flagellum. And a flagellum is a series of overlapping plates. And as the plates slide past, they slide past with a friction that imparts a bit of snap, and the whole tail eventually moves as these plates move past each other all the way down to the end of the tail. And that whipping motion causes it to go that way. Now there's a midpiece of the sperm, and the midpiece is where the mitochondria are located, or the energy-producing structures of a cell. Mitochondria are in all cells. And then the head of the sperm is called the haploid nucleus. That is to say, the bulging part of the head that you may have seen pictures of, and you will see in your PowerPoint. And that contains the 23 chromosomes. Okay? Now, those are either X's or Y's. So males are the ones that are the determiners of whether a baby will be a boy or a girl. At the very farthest point of the head of the sperm is what's called the acrosomal vesicle. As sperm get closer to the egg, they go through a process called capacitation, wherein they have a wearing away of parts of the outermost head of the sperm, and if they get to the egg, then they will begin to have enzymes that are put against the outside portion of the egg, wear it away, and the movement of the tail actually tears a hole, a bit of a slit in the side of the egg that the sperm can enter. Okay? The egg then, of course, as you may know, creates a change in the outer surface of the egg that does not allow any other sperm to enter. Okay. Most animals, including insects, use the sperm egg system. They are about 1/5000th of an inch long. That means you need a microscope to see them. Sperm can swim about 1 inch in about 7 to 8 minutes. Some sperm remain behind, apparently to block competing sperm that may enter. Other sperm appear to surround certain sperm to protect them from acidity. So there are ways to see that some sperm are somehow different. So all sperm, regardless of whether they are insects or mammals, they all look kind of the same. And I will tell you that 10 to 20 ejaculations could veritably repopulate the Earth. We have enough sperm on cryostorage to repopulate the Earth many times over. Now, in terms of the volume of semen, 1, 2, 3% of that is sperm, only that. Okay, something between 1 and 3%, depends. Okay. The average number of sperm per ejaculation is between 180 and 250 million, depends on age, health, time since last ejaculation, and things like that. There has been a reduction in sperm count since the 1940s, a worrisome amount of reduction, and so has the volume of ejaculate reduced in a worrisome amount. We're not sure why that has happened. We're not the ones that produce the most sperm. Actually, pigs produce on average 8 billion sperm per ejaculate. That's a lot. You betcha. Okay, so that's the male system, and that's to give you the nomenclature. So go over the diagrams. Watch this again if you have to. Okay, see you soon.